Greetings. In this segment, I'd like to welcome Dr. Lydia Lee, a faculty member in the School of Social Work and a leading expert on issues and policies related to aging. So thank you, Dr. Lee, for joining us today.
Thank you.
And sharing your thoughts with us. I first wanted to start by asking you if you could help us just to kind of understand aging in the United States and some kind of broad general trends, demographics, some definitions.
I think the most kind of significant trend is the demographic, as you just said. The older population is growing very rapidly in the United States. For example, in 2010, if you walk on the street, about 1 or 1.3 person in every 10 person you come across will be 65 and older. Okay, 1 in 10. But in 2030, just 20 years period, 1 in 5 will be 65 and older. So we are growing in a very rapid rate. In terms of number, from 2010 to 2050, in 40 years period, the number of older people will double from 40 million to 88 million.
So given that huge kind of growth in the number of seniors over 65 years old in the United States, what are some of the kind of issues that you see emerging?
Yeah. Well, maybe I should, I haven't finished up the whole first question that you have asked, which is, within this, what we have to understand older population actually include, usually in the United States, we define old as 65 and older. That's the older population definition. But within that, actually, you can imagine, there's a whole long age range. And in fact, the increase of life expectancy is the primary driver for those demographic trends that I spoke earlier. So one thing we know that within the older population, they are living longer. Okay. So the oldest old growth is particularly rapid. Okay. For example, in 2010, we have 5.8 million people age 85 and older. In 2050, that number is 19 million.
Wow.
Okay, so that is just a huge growth of the oldest old population in the older population. And another characteristic of this demographic growth is the diverse in racial and ethnic combination. Among the older population, the proportion of people who are Hispanic will grow from 7 to 15% between 2010 to 2040, so more than double. Okay, for Black, will grow from 9 to 12%. Okay. So relatively, the white population among the older adult population is will be declining. Okay, from 79% in 2010 to 67% in 2040. So we are very interested seeing not only the growing of the population, but also we're seeing people are growing older, as well as a much more diverse population in terms of racial and ethnic combination. So you asked about the issues facing this older population, some of the salient. There are probably quite a few. I want to highlight 2 of them. The first is long-term care. Okay. Long-term care refers to needing help with daily life activities, such as bathing, using the bathroom, kind of the basic self-care tasks. I'm referring to this level. And it's estimated that 50% of the older people today would need long-term care, that kind of care that I mentioned before. And most of them will need 2 years, and 1 in 7 will need 5 or more years. Okay, so it's the odds that you and I will need long-term care actually is quite high. Okay, more than half of the population, older population I just mentioned. But long-term care services are very expensive. For example, if you want to hire a home health aide to come to your home to help you with this daily life self-care task, it costs more than $20 per hour. If you want to move to an assisted living facility, which many older people now do that, it costs more than $3,500 per month. Nursing home is even more expensive. It costs more than $7,000 per month. So even an older person have saving, okay, it will be drained out pretty quickly if you need long-term care. Many family members are taking up the role of providing long-term care to their elderly relative. But caregiving is a very challenging job, physically and emotionally. So we call caregivers hidden patients because of the toll on their physical and mental health. So in a nutshell, we've been counting family to do the job, but family cannot do it alone. So that is one of the biggest issues. We need to find ways to address this long-term care needs of this growing elderly population. A second issue, I think, is hitting a lot of older people is poverty. Okay. Well, first, really thank you to Social Security and Medicare that the current cohort of older people, can escape those very dire poverty that happened, before 1965. But it's a myth to assume that, poverty is not an issue in older people. Actually, it's a big issue. Many older people are struggling with paying their housing bills, their healthcare bills, getting access to transportation, meeting the nutritional needs. Those are a real thing. So particularly for some groups, among the older population, we know that poverty rate among Hispanics and Blacks are 3 times higher than that among white. Okay. Women also are more likely to be poor than older men. Okay. In fact, partly because as the poverty rate increase with age, and women tend to live longer than men. So the woman poverty is an issue.
Yeah, those are really large issues to be grappling with. I'm wondering from a policy perspective, are there certain policies that have been trying to address the issue around caregiving and long-term costs, and then also poverty in seniors?
Yeah. Well, long-term care, our United States is among the developed nations is the most behind. We just thought that okay, the family will take care of it, or the older person themselves, just for some miracle or magical reason, they can take care of themselves. So we are pretty behind in policy to address these needs, but there has been some progress. For example, in the Affordable Care Act, during the Obama administration, there is an act called the Class Act that addresses long-term care issues. Okay. It is a program that people can contribute. Okay, the government run the program, but the people voluntarily can participate in the program, make contribution their lifetime. So when they have long-term care needs, then they can draw the resources from the program to support their expenses. Okay. But that Class Act was killed. Okay. For what reason? Because it lacks a mandatory requirement. Okay. So it is a volunteer program. But most people don't want to think about being old. Okay. So ask the young people, 20-something or 30-something, to participate in a program that is for your long-term care. It's voluntary. Well, what is their most likely choice? Okay, some may participate, but probably many don't. So it is not a sustainable program. That's why it was killed. To make the program work, the mandatory requirement is needed, I think. In terms of addressing the issue of poverty, currently Social Security has been the primary income for a vast majority of older people. Okay, so strengthen Social Security, particularly for increase the benefit for those with low incomes will help to address the poverty issues among older people.
Yeah. So I know that you as an expert in issues of aging not only do work here in the U.S., but also do work globally, especially in China. And I'm wondering if you could speak to some of the issues facing seniors in China, either that are similar to the U.S. or different.
They share many similar issues. But what's interesting about China is that, number one, their pace of aging is much faster than U.S. and other developed world. Okay, give you an example. For example, for France, it took they increased the elderly population from 7 to 14%, kind of double it. It took France about 115 years to get this proportion, but it took 26 years in China to grow its elderly population from 7 to 14%. So they are kind of packet, fast growth. Currently, China has about 10% of the population is 65 and older, but in 2050, they will reach 25%. Wow. A quarter of the population will be older people in China. So you can see, the magnitude of the growth in elderly population. And another thing in China is that the increase of the old population is very, very, very rapid. Between 2015 and 2050, it will be 4 times the number of oldest old. Oldest old usually referring to people who are 85 years old and older. Okay. So in terms of the issues they are facing, similar to the United States, long-term care. Okay. In the Chinese culture, there's a filial piety. The norm is very strong, and this norm basically dictates adult children to take care of their parents when they're old. However, the family structure is changing very dramatically in China, particularly with the one-child policy. So you can imagine that a young couple now basically has 2 sets of parents to take care of and 2 sets of grandparents. So it's 8 older adults, would be supported by 2 young persons. So the burden of care is quite high for the younger generation. I don't think it's sustainable, counting on just adult children to really doing the job of providing long-term care for their parents. So China has to face this big issue. Another issue, as I mentioned, is in U.S., similar to U.S., is the poverty. Okay. And particularly, the poverty for rural elder people, kind of older people living in the rural area, is more serious. Okay. In fact, not only the poverty issue, healthcare issue and long-term care issues are particularly serious among older people. For what reason? Number one is that many rural youth have migrated to the city for jobs. Okay, so in many rural villages in China, only older people live there. Okay, basically there's no availability of young people to care for them. Okay. And secondly, the urban-rural dichotomy in China is maybe strange to us, which is that many social programs like pension system, like healthcare, insurance, are available only to urban elderly people, okay, and not for those farmers in the rural areas. So they don't have a pension system to rely on when they get old. Okay, in the past they count on their children, but now the children are gone. Some would kind of send back money and some don't. I mean, that is a lot of vulnerability in their part. So rural elderly people are particularly vulnerable in China.
Yeah. So you've raised a number of critical issues, both facing seniors in the U.S. and seniors in China. And I'm wondering if you could share some, from your perspective, some solutions or some strategies that you think are important or being considered to address some of these issues.
For the long-term care, I think we really need to get our act together to really think about, develop a comprehensive long-term care policy. Okay, developed nations such as Germany and Japan have begun the long-term care policy in a social insurance way, kind of a social insurance program for long-term care. since 1990s. Okay, and most European countries have a social insurance program for long-term care, and in fact, some of the even developing nations are catching up, you know, to develop this social insurance long-term care program, and we really have to do it. There's really urgency there. Okay, otherwise it just caregiving. You count on family, you can, but you know they will be kind of exhausted. You know, it cannot be kind of sustained for a very long while. And for a social insurance program, which means that it got to be mandatory participation, similar to what we have in Social Security and Medicare. Okay, so everyone has to be involved. And secondly, as I mentioned earlier, is the Social Security. Okay, there has Social Security and as well as Medicare. Okay, those are two important programs for older people. Okay. However, these programs are constantly under attack. Okay, and some people have invoked this kind of generational war. You know, that all older people are taking all those resources from younger people. Okay. However, remember, older people, they are your parents, your grandparents, your aunts, your uncles, and your neighbors. Think of that, if they don't have Social Security or Medicare to support them, who would they go to support them? It's their elder children. Those are the younger people. Okay, that's one thing. And second thing is that you and I one day will get old too. Okay, we will have our old year. Do we want to be as vulnerable as kind of the pre-Social Security, pre-Medicare era? So we really need to protect these programs and actually strengthen them so that it can cover, you know, kind of lift older people from poverty. Okay, and giving more assurance to those vulnerable groups such as I mentioned, the ethnic minority group, women, and oldest old individuals.
Great. Well, thank you very much for sharing so much information and so many important points for our viewers to consider. And thank you for joining us today. And thank you all for watching.
Thank you.